So we're here to take a moment to speak about working in a very small area, or working, in some cases if we're in the vertebral column, segmentally. Some people will call specific work, right? So the term specific can be interchanged between a very small area, or working in a small area, as well as working intersegmentally. Now, they are not absolutely the same thing, but working specifically can transfer between those two contexts. So as a very, very simple example, I can work specifically here at where the point of my finger is in the soft tissue, or I can work specifically in an intervertebral sense. Now, there are two concepts that we've already spoken about that will help guide somebody as far as working specifically. The concept of macro identifies micro, as far as assessment is concerned, allows us to use a large movement to identify a small problem. Now, if we use that large movement and we identify a small problem, then all we need to do is come in and add a little bit of essentially overpressure, be it direct or indirect. Again, if we're going to go direct, we have an indication that when the patient makes the movement, there is no pain response. If we're going to go indirect, it's because when the patient makes the movement, there is a pain response, so that's kind of our binary choice. But again, what we use is macro identifies micro to identify that small area and then work on that small area. So if we just kind of take a look here, right, what we can do is we can have the patient bend his head to the left and then bend his body to the left, right? So anywhere in here that there happened to be a problem, we can identify it, right? So now we've used this large movement to essentially isolate, get very specific on the area that we may want to work. So then what we can do here is, theoretically, if the problem was here, we just lean and we put our thumb, or we put our monitoring hand where we want it, and we can be very specific. We can use different activating forces. We can have the patient take a deep breath and then let it out. And then we've got a patient active approach to respiration. We can have the patient move in different ways. But the big deal is that what we get essentially is the opportunity to use that macro identifies micro, that big movement to identify a small problem, to position for correction. And subsequently, what we are able to do is then come in once we've identified and when we made our choice to go direct or indirect, we can go right ahead and do that. Now, if the patient was in prone, we can essentially do the same thing as far as the vertebral column is concerned. You essentially make them look like a banana, but we don't have to do that here, because you get the idea, or at least hopefully you get the idea from this demonstration, that you position to correction, so you use the big movement to identify the small problem, and then you apply treatment in a very specific fashion subsequent to that, because you've already isolated, you've already positioned for correction. And we'll have you lay on your side facing the camera. So now what we talk about is the other concept that helps guide specific treatment, or focal treatment, or local, or rather, yeah, specific or focal, or kind of in a very small place treatment. Now, if we wanted to take a look at the glenohumeral articulation, the concept that we use when we're not using a macro identifies micro approach to find the problem and then treat the problem, when we've already found the problem and then we're maybe going to another position. So we found the problem in the shoulder when the patient was on his back. Now we move him here, so we isolate the shoulder. Now what we use is relational motion. One thing moves, one thing stays still, one thing stays still, one thing moves in relation to it. So we can take the arm, right? We found our problem, right? So we've got our lever, or one portion of a lever, our long lever, we've got our short lever, and our fixed point. We're going through the glenohumeral articulation. So we can hold the scapula still and move the humerus in relation to it, or we can hold the humerus still and essentially move the scapula with our short lever on some level in relation to it, right? Or what we can do in this case is we can have the patient, what I want you to do is roll this shoulder backwards and then let go. So we can have a patient active approach. So the patient moves the scapula, and in a relative sense we can hold the humerus still, right? So this specific treatment, this very focal treatment, this treatment in a small area, is dictated by relational motion. One thing stays still, one thing moves in relation to it. And again, choosing direct or indirect is still guided by, if the motion creates a pain response, we go indirect. If the motion does not create a pain response, we go direct. If we were to look at a thumb in this case, right, it may not show up properly on the video, but one thing stays still, right? So we hold the hand still, we hold the carpal relatively still, and we can move the thumb in relation to it. We can put the thumb on bind, and then we can essentially move the hand in relation to the relatively still thumb, right? So again, to work in a small area, to work in a specific area, you can position for correction, aka Macro Identifies Micro, use a big movement to find the bind, and then you apply treatment once you found it. Or you can go ahead and work with relational motion. One thing stays still, one thing moves in relation to it. And we also want to be careful that as far as vernacular is concerned, when we say specific, we're not using it interchangeably for intervertebral, because often people will use the term specific when really what they're trying to say is intervertebral, right? So we want to try to be a little bit more clear with the language that we utilize.